is because a lot of people have had some questions and about CBD and everything related to CBD. So we decided to bring the professionals in that have an incredible feedback loop with their clients, with their patients, and we've discovered some very powerful uses, and there's a lot of powerful anecdotal stories that we want to share with everyone today. So without further ado, I'll introduce Dr. Fred and Marilyn Corder, and they'll begin the discussion.
All right, hello, how are you doing? I'm glad to be here. We're so glad to be involved. Myself, I've been in practice for the last 40 some odd years as a pediatrician in the Washington, D.C. area. And after practicing for a number of years, we've had a lot of conversation with our patients about herbal products and things. And we did research and kind of got involved with this company here. And so our practice has been primary pediatrics, but we've done a lot of sort of mental health, physical health, adolescent health, general health officer. I was a health officer for the county for a while. We've very active on local hospitals at Prince George's Medical Center, which is now University of Maryland. I'm very active there. Dr. Marilyn Corder.
Hi guys, I'm SVP Marilyn Corder. Thank you all for tuning in. This is very important that we share what we know. We have been physicians now over 40 years. We practice in pediatrics, health for all ages. I'm also a geneticist. I do adolescent medicine. But, you know, over the years, we have begun to adopt natural medicine, herbal medicine, alternative medicine, and we have found much success in doing that. And now that we have this wonderful business, Oxygen, links through 5 links, we are so excited about it, to the point we want to make sure that you guys out there, we share this information and that we share what our testimonies, what we have found to have benefited our patients and the village overall. I do radio, I do some TV, I do several things, and I like to get the word out. But I'm so excited for Tupac allowing us to be here today to share and talk. We have other of our colleagues here, so that you, as you hear some testimonies and how we have incorporated CBD in our practice, benefiting our patients, that you can share that with your doctors, with your primary care, as you have been sharing as well with your friends and family. So take notes. We will be able to answer questions, etc. I started getting excited about CBD about a year ago, but many of my patients were asking me over and over, what type of CBD? They're showing me pictures on their phone, like, I got this, what does this mean? You know, what's the best one? So I knew I had to do my research. And in doing so, as I checked out other companies, I found Oxygen, and I found it to be what I needed, what I, as a physician of 40 years, would be endorsing. And that was the drops, the tinctures at the time, the spray for pain, and the therapeutic rub. So many people are and have become addicted to opioids, to pain medications through whatever procedures that they had, from hip replacements to even dental extractions. And, you know, it was my mission was to never write it, so I don't have any prescription pads out there with opioids, you know, in terms of those medicines, but also to make sure that we discourage folks from taking those medications, because after so many days of taking it, it doesn't take long to become addicted. So as I saw this opportunity and saw what I began to do for my patients, such as my ADHD patients, such as my autism patients, such as my patients with migraines, they all been successful. I have a story, if I'm allowed to tell a quick story, because I do want my other colleagues to make sure that they get their information and tell their wonderful experience with CBD. But I have a story of a little fella who has ADHD, and he and his mom and father have been so frustrated because they did not want him on the control medicines such as Ritalin. But they did know that he needed some control of his impulsivity. Very bright young man. As a matter of fact, if you have ADHD, that does not mean you can't learn. That just means you're super bright, and that we just need to slow that brain to a point where naturally allowing you to focus, but not at all taking away your charismatic behavior, personality as well. So she said, I want something natural. I gave her, as it came in, my dose, my tincture, the 500 milligram tincture. And within a day, she sends a message back and she says, thank you for the CBD oil. It's wonderful. And then she goes on to say how she slept well. She hasn't remembered since how long it's been since she's felt this great, and that she's laser focused. And then, by the way, she said, and my son likes it too, because he likes to taste and I can see it. After week, she continued to tell me how he's great. He's like the popular child in the class. People are now coming to his birthday parties and he's getting invites, and he's himself. So on and on, I can go on and on, but it works. It works for children. It works for grown-ups. It works for all of us in the village. So I'm going to then take opportunity to introduce Dr. David Gooray, who, like myself, was trained several years ago. David is a compassionate, nationally known, globally known cardiovascular, internal medicine board, a cardiovascular doctor. So he takes care of all of us. He is I'm proud to say, my personal physician. And I introduced it to David because David, as we all have patients as well as loved ones who would benefit. So I'm going to stop right there because I know David has no problems telling his story. Dr. David Gooray.
Thanks, Marilyn. Can you hear me?
Yes.
As Marilyn said, I've been practicing cardiology for more than 35 years in the Washington metropolitan area. I've been connected to PG Hospital for 35 years. I've been part of the internal medicine training program for that period of time. It so happens that I'm also chairman of the research committee for the last 6 years. Now, over the years, what I found that guides me in the care of my patients is an understanding of molecular biology. If I can link the biology to the symptoms and link the biology to specific care and alter the physiology of the complexities of cardiac diseases, you make a lot of difference to patients' outcome. For example, heart failure. When we understand the biology of heart failure and the molecular activation of all the pathways in it, and we have specific therapy for that, then we make a lot of difference, not only people's symptoms, but that translates into life expectancy. So when Marilyn introduced me to this compound, I started looking at the biology because that's where I usually start. And what is fascinating about this receptor that this compound binds to, this receptor, once activated, controls a significant amount of secondary responses in the brain, which now correlates with not only reversal of pathology, but enhancements of protein pathways that are highly, highly protective. And that translates into clinical benefit. And I'll get to some of that in a minute. What is fascinating, I found out, is interesting about this, is that this single receptor controls myriad set of symptoms. And not only symptoms pertinent to pain, memory, recall of information, Parkinsonian symptoms. It's remarkable. This diverse set of clinical things are under the control of that single receptor that this compounds bind to. And you should be reminded that this compound binds to the cannabidiol receptor, not the cannabis receptor, which is totally different. It's fascinating. When you stimulate the cannabis receptor, as you all know, you get a separate set of results. And you get a separate set of what we call phenotypic results. That means either symptoms or a molecular change. This receptor is uniquely different. That is why when you get a compound which is pure, binds solely to this receptor, you can see definitive benefits. And the benefits I found are predictable, which is fascinating in my own experience. And let me give you two sets of experiences. Nothing more rewarding than to give your mother a drug and she gets better. It's interesting. As a physician, you say don't take care of your family. Then my mother's 92, has severe dementia, severe degenerative arthritis, and my nephew happens to be a physician trained at Hopkins. Took her to Hopkins for her quote-unquote early dementia and memory loss, early memory loss, inability to recognize surroundings, or if she recognizes her surroundings, he'll be gone in 20 seconds. You remember the movie. And after going there for about 2 years, getting especially some of these phosphodiesterase compounds, She did not improve. She became lethargic, didn't want to participate in things. So I said, look, after reading the biology of this compound, I had to make a huge decision. So I stopped all of our medicines, including our arthritis medicine, and started this on the tincture. Now, what is interesting about this, anecdotally, I discovered something else. The young lady who takes care of her, because she needs 24-hour care, and she can ambulate, she can walk, she can respond to you, but then she forgets immediately that she had seen you 15 seconds ago. And I told her to use the 1,000 milligram tincture twice a day for the first bottle. I said, well, let me try this first, but I forgot to remind her to tell her after the first month, when she switched to the 1,500 milligram bottle, she continued the 1,500 milligrams twice a day until 3 months down the road when she was dramatically different. I asked her, well, how many bottles do you have left? She said, this is the last one. And then I realized what was happening. She was giving her 1,500 milligram dropper. You know, when you squeeze the dropper, you get about half or 2/3 of the dropper and you put it under the tongue. And even for elderly people who have difficulty following instructions, I told her to close her mouth. It stays under the tongue or among the buccal area around the sides of the tongue. And it gets absorbed. It goes directly into your bloodstream. We give some cardiac medicines like this, like nitroglycerin. It gets directly into the venous system. It gets into your central circulation. What is fascinating, I found out after 2 weeks using it, she recovered a sense of her presence. That means when she was sitting around the house, she will not only recognize who is around, but remember why they're there and remember why they're not leaving when they should leave. And she will now take hold back of her surroundings, which she never did. The other fascinating thing about it, prior to this, when I would see her, she'll say, oh, she forgot that she saw me 30 seconds ago. I'll see her, say hello, have a little chit chat, and then come back, stay away, come back in 30 seconds. She said, oh, where were you? I haven't seen you in a while. Immediately after 2 weeks, I saw this recognition of me being there before, which she never had. Number two, she had a presence of time and who was around. And now even my sister FaceTimed her yesterday, and she said she was affable, talking, conversational, smiling when she wasn't doing any of that stuff. And the other thing is, to demonstrate how much better she was, she got up, grabbed her walker and started walking when she would not even want to walk because of severe degenerative arthritis. So this compound addressed short-term memory, her mood, capacity to recall information, capacity to be in the moment, and also pain from her degenerative arthritis. In actual fact, she had seen a number of really good orthopedic surgeons who injected the joint. She has complete destruction of her joints. She's 92, so I decided no surgery. And now she's able to walk without much pain. Balance is better. Even position sense is better. She can recognize drops in the flooring where she has to stop and get a set, which is something she never recognized before. It's amazing, the restoration of things that I noticed. The other thing I found, which I was worried about, is toxicity. I was worried about toxicity. I said, she got all this compound for 3 months. Did it create a problem? It didn't. In fact, to me, it accelerated by taking it twice a day. It accelerated the response. The other fascinating thing about it is this: I decreased her dose to 1,000 milligram tincture, half the dropper full a day, because that's all. I happen to be from Guyana, so my mother is there, and I couldn't get, the stuff to her quickly enough, and we did not lose benefit, which I found intriguing. This whole business about when we give medicines, blood pressure medicines. If you decrease the dose of a drug that benefits you, you usually decrease the biological benefit. This compound, despite the fact that I've reduced the dose to 1,000 milligram tincture once a day, we did not lose all the benefits she got. In actual fact, she's even better yesterday than she was a month ago. And I find this is interesting. I can't. There's some biological explanations I personally have, but the clinical benefit is superior to anything that I could have projected. In fact, a younger brother than me, 3 years younger, is telling me, look, he's having problems with his memory. He doesn't know what magical stuff this is, but he started it. And I have lots of people around also who have done this. The joint pain, I think, is interesting. She has degenerative arthritis joint pain. I gave some samples to somebody who has rheumatoid arthritis, and they got benefit within a week, which is interesting. The biological differences are significant. So it addresses things that have biological extreme types of expression. So that's my limited experience with it. And I think I'm going to discover more about the drug, the other range of other biological entities that this compound can address. Thank you.
And thank you, David. I definitely wanted you to share your mother's experience, because often when we have our seniors, 80s and 90s, and as they become demented and have Alzheimer's and just can't remember, we just kind of accept it. But with this, with CBD, our CBD, you have rediscovered your mom. She's back, and I think that's excellent. I know when I even have our patients who have migraines, which now they're saying is the third debilitating condition here in the United States. And I'm fortunate never to have had migraines, but I'm very sensitive and empathetic with the folks who have migraines. And there are times when it looks like they're having strokes. Well, we have what they need, and that's the tincture. And now I have had many of my patients taken off their regular migraine medicines, which is like seizure medicines, which has side effects, especially making you sleepy, and they're taking the tinctures, and they're not seeing the migraines. The migraines are gone, but yet they're feeling much better in all the areas of their body. So menstrual cramps, we tend to have Motrin, Advil, the NSAIDs, the Aleve, and now we know, and hopefully those of you who may not know will hear this, those things like ibuprofen can aggravate and will cause problems with your kidneys, and that's your renal system. So it's on the bottle, but most people don't read that. And of course, even with this COVID-19, we're also hearing and telling folks they need to not be on Motrin, Advil, ibuprofen, because that will aggressively allow the COVID virus to replicate tenfold. So CBD doesn't. CBD is your boost of your immune system. And that's so very important. So I'm going to share one more quick story, and then I'm going to have Dr. Norman Allen come on, and then we'll be here. We're going to be talking and sharing. You have 4 physicians that can tell you how it's working and why it's working, and how we're experiencing great success with our patient population. One story is my patient with autism. Now, I'm also a geneticist. After I did pediatrics, I did 2 specialties. One was genetics, and the other one was adolescent medicine. So I see folks with severe conditions all the way up to adulthood. And with autism, we know it's not caused by vaccines. We got that. But we now understand and begin to understand that there are gaps in the synapses of their brain. And unfortunately, up until now, there was nothing that we could do except identify it, find out where they're on the spectrum, and try to do as many resources and teaching modules that we can, from language to socialization, et cetera. Well, we have CBD, and it's now over the past 4 months have been shown to have positive results. In my practice, and I have more autism than most because I am a geneticist, I'm seeing great results, to the point I have parents coming in like, I need 2 bottles now, with this COVID, I want to make sure I don't run out, et cetera. And the children are more receptive to their environment, and they are not only speaking better, but being appropriate and not being as frustrated and communicating better. So I'm gonna wrap up because I want Dr. Norman Allen, who's also a dear friend of mine, internal medicine, well-trained, been in practice for so many years as well here in the DMV, to begin to share some of his testimonies and experiences that he's having with CBD.
We don't hear him. Hold on.
I think we're still.
Norman, you're muted.
No, he's not. He's on.
Okay.
But we can't hear him.
Oh, wait, let's see. He's not on. Hold on, Norm. Oh, you're unmuted.
Try now.
No.
I just sent him an unmuted request.
Okay. As he's getting unmuted, he's a cardiologist, and he has lots of as we do with success with pain, pain relief, I should say.
Dr. Norm, we can't hear you now.
Yes, ask your daughter.
Okay, there you are. Can you? Oh, no.
What happened? Hold on. It says he's on mute.
Norman?
Oh. Go ahead, say something again. Nope. I'm sending you a unmute request one more time. Oh, I'll mute you and then I'll unmute you. Okay. Nothing. Can you?
So I can keep talking.
Can you hear us? Yeah, we can't hear you.
Can't hear you yet. Yeah.
If you go on the very top, you should be able to see audio and click use mic and speakers.
I don't think he's hearing anything.
Yeah, he can hear us. He can hear us.
Okay. He can hear. He's
Okay.
In the meantime, we can continue.
absolutely. You know, I have no problems with that. Okay. So
If you want me to start the questions, I asked the group to start sending their questions in. Okay.
okay.
And so
Okay.
I'll start off with the questions. There's always been the question. Oh, is that him? Oh no.
Yeah, can you hear me now?
Yeah.
Yes.
Okay, good. Awesome.
Oh, wow.
I'll
Well,
read
okay.
the question
All right. Well,
and we'll let you share your stories.
okay. Well, I'm Dr. Norman Allen, and I'm a cardiologist. I'm an internist first and a cardiologist, board certified in cardiology, internal medicine, also nuclear cardiology. You know, I've been practicing in the DMV area for over 25 years. I did cardiology at Howard, medicine at Howard. Now, I'm from Jamaica, and I heard about CBD years ago, but I didn't want to be involved with it because, you know, I thought it was marijuana. I didn't know that it was different. So later on, I did some research and found out that CBD was not the same as marijuana. It doesn't have the THC, and it was legal. So, you know, my friends, Dr. Corder and Corder, invited me to a meeting, and I went and learned some more about it. And I decided I'm going to try this thing. So I tried it and recommended for a few of my patients. And I tell you, I mean, all the patients that I've used it for so far are amazed. They tell me that it works like magic. So when the patients come to see me for cardiac problem, but a lot of them have pain. What I would do is I'll just spray the area, like spray the knee or the shoulder. And usually they'll say, "What are you doing, doc?" And I'll tell them that I'm using this spray. It's called a PDQ spray. And I said, "Where can I get it?" So initially I had a problem because I didn't know where to get it. I mean, I knew where on the website, but I didn't have a display cabinet. So I got one from the Corders. So I got a display cabinet. I put in my office. I put the products in it. So when the patients come and ask, "Where can I get it?" I'll just point them to the display cabinet, and they bought it. Over the last month or so, I bought over $2,000 worth of products, and most of it is gone. The thing works like magic. You know, I had two patients came one time, and I only had one of the spray, and both of them wanted it. They almost fought to get it. I had another experience with one patient who has Parkinson's, and he has been taking it for about 3 weeks now, and he's still taking his carbidopa, the medicine. He says that since he started taking the CBD, his tremors have been reduced. So, you know, it looks like it's working. So, I've had a lot of experience with patients with pain. Not much cardiovascular experience, but a lot of the patients have pain. I had one patient who came to me last week with a cardiac problem, and so I finished seeing the patient, and she said, "Doc, you didn't tell me about this thing the other patient is talking about." I said, "What's that?" She said, "Doc, my knee's hurting me." But I said to her, "You didn't tell me about your knee. You came about your heart." So there's another patient who was in the waiting room who was boasting about this product. And she said, "Well, can I test it?" So I sprayed her knee. She bought it. No, she came to me because of her heart, not because of pain. So, the thing works. I've had about a month and a half experience with it, and, I tell you, it works. I'd recommend it for myself, for anybody. For the sleep products, my wife uses the sleeping aid, and it works. My daughter uses it too, and it works. So I can tell you from personal and use of my patients, it works.
Awesome. So
Thank you.
yes, that's awesome in terms of a testimony, because people are coming to see you regarding one situation, their heart, but then they see the sign and they're fighting over the PDQ pain relief spray and everything else. It's incredible. And to hear the personal testimonies of Dr. Gooray and his family is amazing as well. So to see that this is actually happening and beneficial on a personal level increases the belief and everything about the opportunity and of course the products. So one of the first questions I want to throw out there is a question that I get all the time is we have different tinctures in terms of this actual CBD oil, okay? There's the 500 milligram tincture, there's the 1,000 milligram tincture, and the 1,500 milligram tincture. How would you, I guess, appropriate those different quantities to particular prospective patients or clients?
Well, first thing on that is probably the fact that they have to be careful what they're getting, because we do know that, like anything else, what you're getting, the strength of it is important. And most of us have been impressed with the product line here that we have an isolate. And that is, we know we're using CBD. Sometimes when you're using some of the broad spectrum, the full spectrum, not that they won't work, but you get some other things. And as Dr. David Gooray was talking about, we like to be able to know exactly what you're using, looking at the results, and then I can attribute it to what I'm using there, as opposed to some of the broad spectrum or full spectrum, where I may be getting a variety of things. Now, having said that, we do know that when we look at the average dose for the CBD, it's somewhere around about 25 milligrams per dose. And if you are using your 1,000 milligram tincture and taking a full dropper full of that, or the dropper full that comes up, is about 25. And that's sort of what I call our medium dose there. Now, going from there, depending on your condition, and we want to be clear that we're not treating conditions, we're actually helping to help your body create what we always talk about, the homeostasis. And that just like when you take an aspirin, the old joke was, how does it know you have a headache? Same thing with CBD. How does it know? You take it, it goes in, it sort of goes into your receptors and begins to do that. And so we do find that starting at a medium dose and then kind of working both ways is the best thing. Like David mentioned and Norman mentioned, even though you may take the CBD, if you drink the whole bottle, I always tell people, you might get a little diarrhea, which is usually not going to cause a problem, but there's no need wasting it. So usually if you start with 1,000 milligram, one dropper full for people who don't have any major conditions, if you tend to have inflammatory processes like multiple sclerosis, like arthritis, you may start and move up. You may also want to use not only your oral tinctures, but some of the topicals. Marilyn, any comment?
So in pediatrics, we often get that question, this is a child, and of course in pediatrics, as we train our doctors, we talk about kilograms in terms of dosage and weight. Well, if you're talking someone at least 60 pounds and we're treating, let's say, Crohn's, juvenile rheumatoid arthritis, different things that even children get. I start at the 500 milligram tincture, and one dropper full, as Fred said, it's about 25 milligrams. And at sublingual, we teach them how to hold it under their tongue. And that has been working in most cases. I start at the lowest if it's a child. If it's someone who's at least 100 pounds, which is an adult, depending upon what we're treating, like cramps, like migraines, etc., then I as well do the 1 dropper full of the 1,000 milligrams, which mostly is about 40 milligrams, which is not a lot. Sometimes it's 1 dropper full or 1.5 dropper full. Now, I have patients who have Crohn's, inflammatory bowel, which is what we call I call it the inflammation of the entire GI tract. And one particular gentleman who's 14 years old, his name is Corey, he came in, he said, I asked Dr. Corey, he told his mom about me taking CBD because I know it helps my Crohn's. It also helps acne. Okay. So when you're 14, one zit is too many. So we started him off on that, and he was still taking his medication, as my colleague said, but within 2 weeks of going back to see the specialist, the GI doctor, not only did she not have to increase his methotrexate, and I say that and emphasize because that has tons of side effects. They were planning to increase it as he was growing older. They not only did not increase it, they discontinued it after having him take CBD 1 dropper full a day. And now he's only on that, and he's thriving well. His digestive tract has calmed down because it's a diagnosis of inflammation. So you know, I'd like to individualize, and those reps out there, if you have someone, I still say check with their doctor. But guess what? A lot of times the doctors don't know, so you can hit me up, give me a call, etc. We can begin to advise accordingly. But it's definitely something that most people don't even understand how it works. As Fred said, it kind of accepts. It's like those CBD receptors are thirsty for balance, and once they begin to take the tincture, it begins to balance the system out homeostasisly. So you just kind of have, okay, I have a headache, or I have a toe pain, or I have something wrong with my digestive tract, and it balances it. Even if they took it for one thing, it balances out the other. So I'm just I'm so positive about what it's doing, especially with the brain, especially with the anti-aging, et cetera, with the folks 60, the baby boomers, et cetera, are beginning to see the results.
Wow. Someone just asked for your name. So I guess because it says Fred Corder here. This is Dr.
Okay.
Marilyn Corder. Okay.
I'm Dr. Marilyn McPherson-Corder, SVP.
Dr. Fred Corder, ND. And also Dr. Norman Rogers, also in the ED, and Dr. Gooray is an ED.
Awesome. So we have a question in the queue here. Can a pregnant girl who has migraine take CBD?
I want to answer that. I want you to ask your doctor. And I say that because you want to make sure that as they're monitoring you for blood pressure, et cetera. Now, what I will say, not being your doctor, and you have, is it migraines, Tupac, they said?
Yeah, migraine.
Okay, so I have patients who have migraines, and what we do, we have a cream, what we call pain relief cream, a little bit of that, rubbing it on your temples have shown great improvement. But check with your doctor, but the cream, topical cream for migraines would be what I would recommend.
Okay. Does CBD help with glaucoma? Is the second one.
Guys?
Dr. David?
Not
It's one of those.
not that I know specifically, but it probably makes theoretical sense. But of course, glaucoma is such a significant disease that you've got to control pressure. I would not suggest to use it for that specifically. Now, coincidentally, it'd be interesting to follow some of the people who are taking it who coincidentally have glaucoma, and they continue their glaucoma medicines. If you look at the biology of glaucoma, it probably makes biological sense that it may help, but we have no evidence that it does. I think we're going to discover along the way, as I hinted at earlier, about the myriad ways in which this receptor controls biology, that something that something like glaucoma, which is controlled by ducts and a release of fluids, which is a receptor mechanism. It may not be surprising to me that people get benefit. And now, to answer a previous question about dosage,
Yeah.
I accidentally, my mother is a 92, as I said, and I said, let me just start with a high dose, because I read on the fact that the toxicity is limited. And when we use lots of our patients tell us they use natural stuff. And lots of our patients, especially elderly folks, quote unquote, use natural stuff. So let's assume this falls in the category of natural things. It comes from a plant, it comes from the hemp plant. And now, when people use natural stuff, there's no definition about dosages. They use whatever is there. It's like drinking a cup of tea. Because of the potential biological safety of this compound, I said I was going to start a high dose with my mother and work my way down instead of doing the opposite. But by pure accident, she was at a high dose for a very long time. And as you know, most compounds are cleared by the liver or the kidney. And as in elderly people, they have a huge problem clearing compounds because of decreased function of the kidney and the liver. What is fascinating about this is that, fortunately, she didn't pay the price for the high dose in terms of toxicity. And as of now, I don't see any reflections of any type of problems. And as I said, once the dose, I decreased the dose to 1,000 milligrams, not lose the benefit. That means, I think, retrospectively looking back at this, we're getting to the point, as you mentioned earlier, where the 25 milligrams is the average dose. But I think in depending on age, when these receptors get deactivated, the high dose makes, now retrospectively, I'm saying this is personal, I'm not recommending this, but
yes,
she responded well to the high dose because of the downregulation of these receptors as people get older, like any other thing that happens with age. She responded remarkably well, activated them, and now she can use the medium dose with sustained benefit. And even my sister thought that even her mood was definitely better. So I think as we pay attention to the details of this, we're going to have not only anecdotal stories, but I think we might have a little bit better clinical understanding of what happens. To answer questions like, getting back to pregnancy, it's interesting. We worry about pregnancy and things crossing the placenta and affecting the fetus, especially in the first trimester. This works through a receptor in the brain. So biologically, I don't expect it. I don't know about crossing the placenta. And this is something that we may probably have to pay attention to find out about safety, because that's a unique physiologic setting that we have to pay attention to because we don't know. But I think as our experience and understanding of what happens progress, I think we'll probably have answers to this.
So,
I think that one very good point there is that the combination of, we look for empirical data, and then having trained for 30, 40 years, we have those kind of reports. One of the things with CBD, we don't have that kind of data sometimes, but with the fact of what we call it safety margin that we see in the products has made us a lot more comfortable in working with it.
Definitely.
And when we do see the responses, lets us kind of open our eyes and our abilities to sort of say, try these more, and then look at what our response are.
and I want to say also, being a pediatrician, we see lots of brand new babies and the mothers, and often it's the case, 50% of the mothers when they come in as they're breastfeeding, the doctors have put them on Percocet for pain, opioid for pain, and they're breastfeeding. So I'm like, no, we can't make addicts out of the babies. The babies are asleep. So what I tell them, when you have pain, I put them on, I tell them, if you have that much pain that you have to take Percocet, first get off of it. And I don't even want you on the inside. So wherever the pain is, they can spray that area. They can, if it's a C-section, etc. But weaning them down and putting them on CBD, which I know increases the brain function, not only of the mother, so she can be more alert, taking care of her baby, but also the baby.
I think to extend that point in breastfeeding, we know drugs that get into breast milk crosses the breast milk and the baby gets it. Looking at this compound, I doubt, because of where it binds and how it's handled, I would think that it would not get into breast milk, even if there's a lack of any evidence about safety in babies.
Right.
Which is something that Now, I don't know if Norman would comment on this. A lot of people use St. John's wort. A lot of men use St. John's wort, right? I was, let me phrase this. I was flabbergasted with what happened to one of my patients recently. Everybody thinks it's natural. Yes, it's natural. And I had a gentleman who was admitted to the hospital, and he was 88, admitted to the hospital with a heart rate of 20. And got him back better. He was on digoxin, we know slower heart rate. And after 6 days in the hospital, sent him home with a heart rate in the 70s. He came back 3 weeks later, again with a heart rate in the 20s. Supposedly stopped his, digoxin. Got back, his digoxin level was not very high. It was 0.2, and as Norman would tell you, that's a very low level. Again, heart rate at 20, got him out, came back 3 weeks later with the same thing. So I said, hold on a minute, something is wrong. So I got the family together on a Sunday, and there were 15 of them. So trying to figure out what happened. So I said, look, there's something wrong. He's taking something that we don't know. Everybody swears, no, he's only taking what you're giving him. I've stopped his digoxin, supposedly. And great-granddaughter stood up, I know what grandpa is doing. He's got stuff under his bed. I had his grandson go home under the bed, and everybody waited. And in an hour, he was back and brought a bag full of herbal stuff. And one of it was St. John's wort. And I had to learn something. I said, hold on a minute. He continued his digoxin. The reason for that, a physician he knew for 40 years gave him digoxin way back and said, look, this pill is going to make you live longer. He's now 88. He would not stop digoxin, although I told him to stop it. He had stores of digoxin all over his room. So he's continued to take the digoxin. But what is fascinating, he was taking St. John's wort. I went to the literature and looked at it, and St. John's wort displaced digoxin from binding sites. So you can have a level of 0.2 and get digoxin toxicity.
Right.
That taught me a lesson about quote unquote natural and herbal stuff. So when I look at this compound, I look at that in the background. Yes, it's a plant product. Yes, we understand its biology. Yes, you have to know. So we have to, it's valuable, no question about its value, no question about its benefit. If my mother's example is a reflection of the safety of the drug, I will say it's safe. Yes. Okay. But I have no data. I think we got to learn, and we are very careful as usual with what we give patients.
Yes.
Highly effective.
About the use in glaucoma. I know there in Jamaica, Dr. Mandler West, who's a former professor of mine, did a lot of study on marijuana and glaucoma. So marijuana works well for glaucoma. Now, whether it's the CBD, I'm not really sure. I think they're doing that, but marijuana itself works for glaucoma.
Dr. Gooray, you mentioned the blockage in terms of the channels in the brain as a result of inflammation in our last conversation. And you were saying that because of CBD's anti-inflammatory properties, you're starting to see some blockages kind of unblocked and the messages going through.
We realize in the case of dementia, it's an inflammatory vascular problem. And we know the early signs of dementia is these small vessels in a deep part of the brain thrombose and clot. And that's an inflammatory mediated mechanism. Lots of the disease, everything we do, and Dr. Allen can confirm this too, even heart attacks. The rupture of a plaque is an inflammatory process, and a clot forms. So this business of inflammation is not inflammation from an infection, as you think of inflammation. This is biological inflammation mediated by a set of things that are a little bit different. Even when we treat blood pressure, we give drugs that affect inflammatory pathways indirectly. These drugs we call ACE inhibitors, and they have anti-inflammatory benefit. So inflammation is the underlying mechanism of disease process. Inflammation is the underlying mechanism of the damages of aging or the passage of time. Now, this compound we know has significant anti-inflammatory benefit because of the receptors it binds to and how the molecule works. So if we extrapolate, one would think that, look, we can't make it a panacea saying, look, every inflammatory pathway, but I wouldn't be surprised that all of these pathways which have quote unquote molecular inflammation as their underlying mechanism, people are going to get benefit, whether it's rheumatoid arthritis, whether it's dementia, whether it's Parkinson's, whether it's degenerative arthritis, whether it's neurologic pain, whether it's some of the CNS problems with attention deficit disorders. There's a commonality there. And you see this benefit across a cross-section of things. So it'll be intriguing for me to figure out as time goes by that common link.
Speaking of Parkinson's, somebody asked how many milligrams of the tincture do you recommend for Parkinson's patients?
In fact, I've got two very good friends of mine who've got Parkinson's, and one is a physician. One is a tremendously successful person in business. I've started with a 1500 milligram.
Yeah, my patient is on 1500 milligram.
I started a 1500 milligram tincture, and I'm not going to decrease it. I'll keep it like that, and then see their response. And as you know, I was mentioned earlier, I think as Norman said, you see somebody within 2 weeks having the reduction in tremors. And the other thing about these Parkinsonian drugs, they have tremendous side effects. You know, these dopamine drugs, tremendous problems with blood pressure, heart rate, things that affect us when we follow our patients. You know, so if one can, in the process of time, I think what I'll do, how I'm going to handle this is that if they do better, I'm going to gradually decrease the dose of the Parkinsonian compound slowly and see what happens. You know, and follow them, because we also know there are limitations in these Parkinsonian drugs, not only the side effects, but limitations in benefit.
Yeah, we always say now in the presentation that our bodies don't have receptors for all of these, you know, synthetic drugs, whether it's Tylenol or, you know, Advil and all of this stuff. Our bodies have receptors for CBD specifically. So we have a lot of questions popping up, so we're going to have to up our pace here. The next question, okay. Your recommendation for menstrual cramps is 1,000 milligrams sufficient? For menstrual.
I'm going to take that question, if I may.
Short answer.
Short answer. Okay. Yes, 1,000 milligrams is sufficient. And what I will tell them is that, you know, when we talk about menstrual cramps, we'll say when you think your cycle's coming on, take the NSAID, Motrin or ibuprofen a day or two ahead. I'm telling my teenagers, my young adults, to go ahead and just stay on the CBD, because not only does it stops the inflammation, because as you're on your cycle, that's inflammation of the uterus, etc. So you want to stay on it anyway for not only the pre-cramps, the cramps and post-cramps, but all of that goes along with that system, as well as your joints, etc. So I don't want you to just take it as this is pain. Now, in addition to taking the one dropper for 1,000 milligrams, you can also, where that pain is, years ago we'd say rub the tummy with the cream, etc. Just go ahead and spray that area, spray that back, you know, and you could do a nano, but you want to just stay on the 1,000 milligram one dropper. Thank you.
We also have somebody asking which CBD product helps with digestion.
Well, you know, the digestion, that's one of the first products were used. The GI doctors have been using CBD oils for the digestive, the irritable bowel, those kinds of things. So we would definitely, as Marilyn was saying, taking a tincture on a regular maintenance basis and helping your digestion, helping your overall health.
Okay, let's see, what else do we have here? Would you say to a physician who says there's not enough studies on CBD to recommend my patients? What do you say to doctors?
Well, I finished medical school back in the 70s, and we did not even have an endocannabinoid system. Okay, and in 1970, marijuana was put in the same classification as LSD. And so lots of doctors are still from that era, that we were not trained with knowledge about it. And I always tell people about cbdcentral.com. This is a website you can go to. It will reflect some of the data. NIH, a lot of the universities have already been doing studies. But lots of times when we're in practice, we kind of do what we used to doing. And since we weren't used to doing it, we kind of don't go forward with it. And so you can go on cbdcentral.com, not only just read a report, but actually download reports from NIH, reports from Harvard, reports from major universities that have shown that they do have some responses. And so a lot of times you may get that response because it's not a part of our regular armamentarium of treatments.
Okay.
David?
You know, over the years, over the last 40 years, as Dr. Cody is saying, we've hung our hat on clinical trials to define the value of a compound. And you got to do clinical trials, you got to get a population. The same thing Dr. Fauci is facing now with this virus, right? You got to do a quote unquote clinical trial, which means you got to do a double-blind placebo-controlled trial. You do 2 arms of the study, use the compound. Now you do that when there's concern about safety, value, which is what, when you get an antibody to this virus, it's a safety and its effectiveness. You have to do a trial like that. Now, what we have on a compound like this, which has evolved over the last 40 years, as Dr. Cody said, we never knew anything about the cannabinoid system. And because of very bright people understanding molecular biology, they have defined the system, and they've defined how to address the system with molecules that are a part of nature. We're never going to get the so-called classical double-blind study to justify the use of a compound like this. What you're going to have is, this is not only anecdotal, but you're going to have a lot of biological data, as Dr. Corder said, that's available in the literature, coming from reputable places, very good, reputable researchers who are going to define this compound and its value, and incidentally also define its safety. So if you're going to use not simple, but if you use the umbrella of saying we have to wait on a double-blind clinical trial to justify the use of the compound, I don't think we're going to see it. Okay. But what we're going to see, though, is a collection of lots of data. Although there's no classical double-blind clinical study, there's enough data that's already there to look at its safety and its clinical benefit. And then as we get exposure to its use as physicians, we're going to probably end up doing, in our own way, a double-blind study without actually doing it. Because we're paying attention to a lot of things, this compound. Now, we're using it. We're not using it blindly. We're using it very carefully. We know its biology. We know how it works, and we're using our own sense to guide us. And we're always very cautious and very careful. But if you see the clinical benefit that we see with this compound, without side effects. And if I use, as I said, go back to my mother, what you worry about is the side effects. The clinical benefit is there. So you wait on a clinical trial for the side effects. If I use my mother as an example of someone who should reflect the side effects and she didn't, then I said, oh, well, I've discovered something here along the way.
And they're now teaching endocannabinoid systems in the medical schools.
It is.
I guess doctors our age, we may not know about it, so forgive us when we say, I don't know, it's not enough clinical trial. Yeah. But the younger doctors are now beginning to learn and adopt endocannabinoid system benefits.
Okay, we have another question. Can CBD help lower LDL in cholesterol?
Let me answer that. The funny thing about it is LDL and cholesterol. We hang our hats on LDL and cholesterol, and let me not disappoint lots of you. You take a statin, it lowers the LDL, but the long-term benefit of statin is not necessarily lowering LDL. It's the molecule itself. It's a molecule that makes up the statin, the compacting molecule that gives you anti-inflammatory benefit. When you get a heart attack or a stroke, you come into the hospital, you get a large dose of a statin. The benefit is not because it lowers the LDL, the benefit is in the molecule itself. If I use that analogy and saying, look, it may not be important that it lowers LDL, it might not be important, increases LDL. Let me give you an example. There are classes of medicines now being used for diabetes that increase LDL. Okay, we're seeing them now. And these compounds are this sodium glucose co-transporter molecules increase LDL. Despite increasing LDL, there's a reduction in death. So we're learning something now. We're learning necessarily, yes, you have to lower LDL. Yes, it's valuable. But we realize that even if you take a compound, and if you say the worst case scenario in any compound can increase LDL, but there are lots of compounds now which are beneficial that increase the LDL, that actually improve, decrease mortality, improve outcome. So I wouldn't, in my mind, say this, whether it lowers or decreases LDL as being a significant finding.
Got it. Thank you for that. And then we have how does CBD interact with blood thinners?
Very good question. Biologically, I don't think it will. But it's a very good question because blood clots, especially venous clots, it's a sort of an inflammatory mechanism that starts the clot. Okay. I doubt that it interact with compounds like we take to prevent blood clots, like Coumadin and the other compounds, or aspirin. My sense is it probably enhance the benefit of aspirin. There's some evidence that it may do that. So it's a good question.
The thing is, we tell folks because it does enhance the benefit and it helps with. I don't know if you can hear me.
I don't think it'll.
Can you hear me?
Problem.
We can.
So we do say on a blood thinner that you don't want to take CBD. Can you hear me? Because it does do the same thing. It enhances it. So you don't want too much blood thinning activity.
Yeah.
Okay.
Okay.
Especially aspirin. The other blood thinners we don't know much about.
Okay. It says, does the tincture make you gain weight or increase appetite?
You got to find a better excuse. Now, you might be feeling better, is it eating better, and that might be why you're gaining weight, but it's not the tincture. Unfortunately, I see a lot of young adults and things, and we have a lot of excuses for gaining weight. Most of it is usually more related to our bad eating habits than anything else.
So the tincture does not make you gain weight. As a matter of fact, patients who I've had on it and my reps have lost weight because it increases your metabolism in a natural way where you're not having any jitters, and it helps your digestive tract. So it will make you more regular as well as allows your absorption of the good things. So drink your water and do your tincture, and you'll find that that overall, I call it alertness and feeling good will also make you feel better about eating better.
Okay. What experience do you have with treating adults with mood disorders, depression, and anxiety? And would you recommend for postpartum depression? And what are breastfeeding precautions?
Okay, let me hit on part of that first. Even though as a pediatrician, I see a lot of young adults because they have children. And for years, I've known that some of my mothers who have manic depressive don't like taking Prozac, don't like taking lithium, Zoloft. And have Zoloft, have refused to take the medicine. And they'll come in acting very normal. And I'll say, what are you taking? So I don't take any medicines. I'll ask them, what are you smoking? And they'll look at me like, what do you mean? Because we have known for years that CBD, marijuana, has had effect on patients who have manic depression. And so we do know that the CBD does have significant improvement with mood swings.
Right.
I have some young adolescents. One adolescent, one of Marilyn's stories of a young girl who, you know, you get your daughters and get that 13, 14, 15 age where you don't like them anymore. Still love your daughter, but you don't like them because those mood swings. We actually had a young lady who started taking the CBD.
1,000 milligrams.
1,000 milligrams once a day. After a month, the mother came back and said, I like my daughter.
Right.
I actually see a change in her. After 2 months on the medication or on the CBD, the mother says the daughter reports, I like taking my medicine because it makes doing my work easier. It makes me able to follow through on things.
And she came off of the Zoloft. She was on mood swings medications, and she didn't like how that felt. So she's been on it now 4 or 5 months, and she's doing very well. The teachers are bragging, you know, and complimenting her, the parents, etc. So yes, it does help with the postpartum depression. We do see those mothers who come in and they're off balance, and it does help. The 1,000 milligram dropper does help, and we even seeing that in menopause. So we're beginning to see that the CBD components helps those balancing the receptors both in postpartum as well as menopausal women.
Okay.
Oh, yeah.
The question is, does CBD help with fibroids?
Interesting. Now that I can't say for certain. I just know fibroids, we suffer from fibroids in terms of, I call them inflammatory reproductive tumors that many people of color, women of color have. So that's to be studied. We should see that coming through. It does help with reproductive. It does help the reproductive system, CBD. So with that being said, I
Does it
feel
mean you
it
get
does.
pregnant easier?
Yeah. Don't blame us on those pregnancies.
Does CBD help with urinary incontinence?
Interesting.
Inflammation.
That's
Guys.
Interesting question.
kind of something.
No.
If one assumes that urinary incontinence is a problem with the neurologic problem with the lower back and the inflammatory changes that happen in the nerves, then theoretically it gives now. Here it is again. My mother. I can't say this right. She used to get up 4 times a night, every 2 hours, you know, to go to the bathroom. Although she went, and she'll get up half an hour later, and then you question her, Mom, you just went. See, are you calling me a liar? I don't want to go. So what we've noticed now, she is able to sleep 4 to 5 hours without having to get up. Now, this is anecdotal information, whether it is or not, but I'm paying attention to this too.
Right.
And it sort of makes physiologic sense, biological sense that one would get benefit. With urinary incontinence and urgency, which is 2 things you worry about: frequency and urgency. Both of those have improved.
This got a
And
real,
both of those are inflammatory processes.
this got a real dangerous question. It says, would you suggest to stop high blood pressure medicine immediately, or take it with CBD, or stop it after a period of time? Dangerous. That's very dangerous. Tina,
Now you need to
Keep
continue your blood pressure.
say that again.
No, I wouldn't recommend stopping your blood pressure medicine. I would not recommend stopping your blood pressure medication.
Yeah.
You know, no doctor would suggest that.
That's right.
It may
I would agree with that too.
And that's from a cardiologist. All right, let's see. If a patient is on chemo due to Crohn's, would it be safe to use CBD?
Marilyn actually has the case of that. Chemo, when they have Crohn's and
Oh my goodness. So right after Christmas, I guess around this week between Christmas and New Year's, I text one of my patients because I've been thinking, like, okay, what patient has this, what patient has that. So I text one of my patients, and I kind of told his story at the beginning of this webinar. And I asked the mom, I said, have you ever heard of CBD? And she said, funny you should ask. She said, Corey was asking me to ask Dr. Corder about CBD because it helps acne, but also has been known to help inflammatory bowel, which is called, one condition called Crohn's, which the medication for that is chemotherapy, methotrexate, which if you look it up, partners, if you look up methotrexate, it's something that we treat for one thing, but you see all the side effects. And this young fella, 10th grader, was suffering all the side effects of the methotrexate for his Crohn's. And Crohn's is inflammation of your digestive tract from mouth to end, your colon. And he lost a lot of weight, and we finally diagnosed it, and they put him on methotrexate. Well, he was due to have his evaluation by the GI middle of January after the holidays. We started him on the 1 dropper for 1,000 milligram. I made sure he liked it. He took it. We started it in the office. I'm like, look, your mother's gonna pay this, or I'm gonna gift this to you. Here's a dropper full. I want to make sure you like the taste. A lot of CBDs taste awful, not ours. He took a dropper full under his tongue. He said, I like it. And for 2 weeks he took it. I get a text from the mother while we were in Ghana, and she said, oh my goodness, Dr. Corder, wait till you hear this. We went to the GI doctor. They measured the white blood cell, which is a measurement of the inflammation that we know that Crohn starts and shows. Instead of increasing the methotrexate, which was the plan, the doctor said, wow, I don't know what's going on, but the methotrexate we can now decrease and completely stop. Not decrease, stop completely. Not increasing it, but completely stop, because your Crohn's is now in control. The difference was 1 dropper full of the CBD, and he's on it. They never run out. He's doing well. He's thriving well, and his acne is gone.
And also, I think the important part is he's working with the doctor.
Yes.
And so we're working with our doctors, using the CBD,
Being
monitoring, and kind of moving forward.
Yeah.
Okay. We have so many questions in here, right? We also have a question. Says, I work with special need kids 12 to 21. We need CBD, but as educators, we can't tell parents this. How on earth do we start convos with hopes in getting CBD in public schools?
Well, we might not be able to get it to the public school level, but the public is beginning to respond.
Individually.
Yeah, on an individual basis. So sometimes if you talk to the parents and even encourage them to do their own research. And so if the parents do their own research, there's articles out there, some of it works for some people, some of it doesn't. But just raising the question of, this is some other things, just as if somebody had a cold. Hey, have you tried this thing or that? And so that information may be helpful of spreading that. Our school systems are not going to be the ones to do that. This is really more of a personal one-on-one basis.
Going to their doctors, and hopefully their doctors can recommend, and going to CBD reps, but it's going to be a collaboration of the parent and whoever the provider, and maybe the teachers can recommend, whoever works there could recommend a few doctors who recommend CBD after they see the evaluation.
Okay, somebody was a little confused as to the 500 milligram tincture and using 1 dropper worth, but the doctor said 25 milligrams. So let me explain that. The tinctures are 500 milligram, 100, and 1500 milligrams. We have some feedback. If you have 5 feedback, I don't know why we're having feedback. You have to divide that by 30. I'm not sure why we're getting such. Hopefully we don't have somebody on 2 devices. Okay. All right. Let's get to the next question. I'm not sure why there's feedback. If there's 2 computers on, what I'll do is I'll mute. Unmute. Can you guys hear me now?
Yep.
All right, good. So, okay. So that was to clear up how to measure the milligrams on the tinctures. Let's go to the next question. What about 3 and 4-year-olds? Child is ADHD. Mom has been giving him half a gummy. Wants to purchase oils. Let me unmute Dr. Corder.
Everyone, because our 3-year-olders, depending on how much your tolerance is whether we get the same echo. And so we try not to do too much medication with our younger kids because of that energy level. The learning curve is always there. And so we have to be careful kind of doing things with them. On the other hand, because of our safety thus far, we found with our CBDs, that's a good thing. And so you may try a lower dose and kind of half a gummy and see what the response is. But be careful making the diagnosis of ADD at an early age, even though the child may be active and may later have a diagnosis, but they're still on this very rapid learning curve. And so lots of children who have ADD are also very inquisitive, very interested in learning. And the biggest problem sometimes for parents and teachers is keeping up with them. And sometimes it's not the child, it's us trying to keep up with them.
Okay. And we also have a question here saying, I would like to know if the tincture can still help a 80-year-old with losing her muscle.
Repeat the question.
Muscle tone, muscle mass loss in 80.
Yeah. In elderly.
You wanna answer?
I don't think we have a good one on that one. You know, one of the things that I'm not a gerontologist, but you know, one of the problems with aging is you do get loss of muscles. As you get loss of muscle tone, or loss of muscle, your ability to exercise, which then causes further loss, sort of compounds there. You know, one, if you're improving their mental condition and maybe they're willing to sort of get up and move around, that may be helpful to you. But we can't say that the CBD itself is going to help with the muscle loss. Some of this is an aging process. Some of this is also a process of where we begin to become less and less using of our muscles and also lose tone.
And maybe with the pain spray or cream, we could do some passive exercise and sheer exercising to help regenerate some of those muscle fibers.
Okay. We have another question here. So many questions. I don't think we're going to get through all of them, but we'll try our best. It says, tea has been recommended to help respiratory health, to help fight and assist with recovery from coronavirus. The recommendation from pathologists was natural tea. Is Montevita or oxygen CBD a natural tea leaves?
Yes, I just did 3 shows on that yesterday. So a couple things with what we're hearing with to fight the COVID-19. The hotter the beverage, the better. Teas are best. Anti-inflammatory is better. So there you have it. Our CBD tea is natural, it's therapeutic, it's anti-inflammatory. Take it as warm as you can. On that same line, even with the tincture, that helps boost your immune system. We talk about even gargling with things like zinc, the old-fashioned Listerines, because we know, and let me just sidebar, we know that the way we contract the coronavirus is through our mouth, our nose, et cetera, our airways. And we want to make sure that as we hear about the throat tenderness, the throat pain, the sore throat that starts first, then folks get better. And then within 4 or 5 days or within a week, they begin to have problems with coughing. We're seeing this over and over. I have 3 or 4 of my friends who now have COVID-19. You want to fight it before it gets into your lungs and before it gets into those alveoli, which are part of the itty bitty parts of the lung surface. So you want to gargle with old-fashioned Listerine. You want to take as warm of a beverage, and our tea is the best, warm a beverage as possible, as well as you want to get your zinc and you get your lemon, the lemon and garlic, so that that's already in your airway begins to go away. So yes, of the teas, I recommend our CBD teas.
Okay, we have Dr. Jack Day. I'm going to unmute you. She had a comment about the breast milk. I just unmuted you. You might have to unmute yourself.
Yeah, she just had a grandbaby.
Yeah. We just unmuted you on our side. If you could unmute yourself on your side, you can be heard, Dr. Jack Dale. As she's trying to figure that out, let's go to the next question. Does CBD help with hair loss?
Interesting. You know, CBD is now having quite a bit of interest as anti-inflammation. And we now know some of the dermatologists have found hair loss is due to inflammation of your hair follicles. Now, it's not PRP, it's not the cosmetic implants, but you know, with CBD topical spray, as well as the tincture, I would just say, in my opinion, it will slow down hair loss. There's Carol. Is that Dr. Jack Dale on the line?
Yes, it's me, and I'm babysitting.
We can hear that. We can hear that.
My 3-month-old granddaughter.
Awesome.
So I understand that CBD occurs naturally in breast milk. Dr. Corder's?
Yes, it does.
Right. So you know, my daughter is 3 months post delivery now, and you know, her pain level has been very well controlled, but she's very reluctant. We talked about CBD, and I said, Well, I don't know. I've seen some data where CBD is actually found naturally in breast milk. And someone said, well, that's probably why the babies are so happy when they breastfeed, because they're chuckling all the time. Well, Dr. Corder, can you address that?
Yeah. Well, you know, it's interesting because I'm doing my own, I call it my study, my pilot study in the office. As a geneticist and as a pediatrician, we do know there are quite a few things that's special in breast milk, DHEA, different things, including what we call the endocannabinoid, the natural things. That's why we even talk about the breast milk immunity boost. Now, I don't have the scientific information that says, okay, all of the breast milk, it has a certain amount of CBD. But again, I have read that and I have heard that even as a mother takes CBD as she's nursing, that increases and helps the baby in terms of function, as well as we know it helps the pain of the mom. So that's the jury's still off on that. But I do have some mothers who are breastfeeding with CBD on board, be it, you know, sometimes they have different pains, migraines, they do the cream, they do the spray for their carpal tunnel, and they also do the tinctures.
Thank you so much. I appreciate it. Thank you. I'm listening on.
All right.
Hey, Dr. Gooray.
Hi, Carol.
How are you?
Congrats.
Good.
Okay, Dr. Norm, we're getting some feedback, but I think you have multiple.
I can't hear you.
Do you have, okay, we're hearing a feedback. Your line.
I don't know. Let me computer off.
Oh, you just muted yourself.
Still there.
It's still there. I don't have another device.
All right, so we're gonna keep you muted for a second. So you keep you muted for a second. All right, so the next question is patients with Alzheimer's who are taking, I don't know how to say this, mamotidine?
Mamotidine.
Yeah, mamotidine. Can they take CBD, and how much doses can they take?
What I did not see any benefit of any of those compounds, the R receptor, the mamotidine in my mother. In fact, it made her more lethargic, lack of responsiveness. She withdrew in a corner. So I made a conscious decision of stopping them and put her on CBD. So I have no information of the two compounds used concomitantly. And we all know from the data in these compounds, you may slow down the course of the disease if you're lucky, but you don't change the natural progression of disease. You may slow down the rate at which the dementia occurs, but you don't change its natural course. So that's how I made this conscious decision of taking away these compounds that we traditionally give people. And I removed all of it and just give her CBD alone. And a couple of things I found interesting. Number one, it did not only not slow down the course of her disease, it restored some of the things she had lost, which is, I find, revolutionary when you think of people with dementia.
Wow.
Yeah.
Okay, and then the next question we have here is, do you know if CBD helps with lupus?
Oh, yes. Oh, yes. May I answer that one? So this CBD is excellent for autoimmune disorders. There's something called lupus, sarcoidosis, MS. So that's what those, I call it the common denominator for those autoimmune conditions is actually inflammation. And many of them, people who suffer from that, they're taking medications, not only the chemo medicines, but they're taking steroids, IV steroids. We just had a testimony on the SVP thread of a young lady who has MS. She has an aggressive MS, and she said, you know, with the gray lesions and the light gray and the dark gray. Well, she said the lesions that were causing blindness and pain and problems, you know, were increasing. So she had to have some IV steroids for a while, and then they stopped that, but then it was still increasing. And she started, one of our SVPs gave her the tincture, the 1,000 milligram tincture. So she started taking 1 dropper full. She writes that in her testimony that we just read yesterday. And she said, to her surprise, and she's so grateful, when she went back to her doctors, they repeated the MRI, and they saw where those lesions were gone. And she's been feeling so much better. So she's just said, I'm so grateful for having started the 1,000 milligram tincture, 1 dropper full of the CBD. So I have a colleague of mine whose wife has MS, and I gave him the 1,000 milligram bottle, 1 dropper full, and that was about 2 weeks ago. And after 2 days, he said that his wife, finally slept all night long, pain-free, and has been sleeping wonderfully ever since. So I'm curious. I told him we're going to get that repeat MRI real soon, so we can begin to see not just from her symptoms, but even from the brain scan, how it has improved the MS.
Okay. All right, Dr. Allen, we see you fine now, and the feedback is gone.
Yeah. My IT specialist, my daughter is here helping me out. Yeah.
Okay.
Always works.
We have a lot of different questions here. Hold on, let's get back to the last question. You just actually answered one of the questions when you talked about MS.
MS, yeah.
My son has sickle cell, and I'm really scared to put him on CBD. However, things started to get worse. So 4 months ago, I put him on a 500 milligram tincture, and he has responded wonderfully. What exactly is CBD working on first, I guess?
The inflammation and the pain.
And I think that lots of things we talk about is our inflammation. And with sickle cell, our biggest problem is the sickling of the cells and the inflammation that occurs inside. And so when we can kind of get those inflammations down, so whether it's happening in the lungs, the spleen, other parts of the body, that helps improve the quality of life, the mental status of our sickle cell patients.
And the pain.
Oh, and pain.
And the pain. And one thing, as your son, and we trained at Howard, so we do know a lot about sickle cell. The inflammation, that the sickle cell process that Fred was mentioning, is very painful. And we want to make sure that, and I'm sure you on the more modern things like the hydrourea and the prophylactic antibiotics, but you want to anti-inflame even with the joint. So make sure you have a spray and a cream, because topically, when your son has discomfort in those joints, we could keep him from going on pain medicine by doing the topical CBD as well.
Okay. All right, the next question. I have a relative who's interested in using our tincture for pain from shingles back in January. She's 70 years old. She has other health problems, and she is on blood thinner. Should my relative use a tincture or a topical for the pain relief?
Topical.
Yeah, we'd probably go more with a topical, and I think Dr. Jack Daniel actually had experience with patients with shingles. And by using the topical, either the spray and or the cream has been helpful. Of course, our blood thinner question kind of comes in there, so we kind of veer away a little bit from the oral, and we'll stick more with the topical and see what kind of response we get.
Okay.
And that's on the dermatomes.
Back to the glaucoma. What does the other doctor think?
Norman?
Opinion.
Well, I don't think there's any confirmatory study now about CBD and glaucoma. There's been a lot of study about marijuana and glaucoma, and that was done in Jamaica. I know that is a fact because one of my former professor, Dr. Man Lewis, has been using it for glaucoma, but that's marijuana. I'm not sure about CBD.
Right. All right, and let's see. We have another thing here. CBD and reaction with blood thinners. I don't know. Coumadin and Xarelto.
Coumadin.
Coumadin.
Xarelto.
Coumadin and Xarelto.
Coumadin, Xarelto.
Eloquent.
Eliquis and Plax.
Eloquent.
Eloquent.
And Pradaxa. So those, yeah. So those are what we call novel. Well, Coumadin is an old vitamin K antagonist, and then the others are what we call novel antagonists, anticoagulants. As Dr. Corder said, that the CBD seem to potentiate the effect of these anticoagulants. So the recommendation now is to avoid with those medicines.
That's right. Because it naturally anticoagulates. Obviously, the people, whoever is on that, needed it because they had thrombosis, clots, etc. So we don't want to add to that. So that is one of the ones that we, as physicians, and even the company has recommended. So it's not just us saying it; it's the company not to use CBD with folks who are on the anticoagulants.
This is just a comment saying these physicians are trailblazers, and this conversation is priceless, and such. So awesome. Okay. Let's see. We have so many different questions here. Let's see. As doctors are still learning about CBD, are your patients sharing any adverse conditions they may be having, other than diarrhea?
That's only if they drink the whole bottle. But other than that, we've not really had a problem. And that's really been one of the big issues. The public is coming to the medical profession with, hey, I feel better. I have less symptoms. I'm thinking clearer. And of course, they would like for the doctors to say, that's good, keep doing that. But because of the way we were trained, and sort of just like with Dr. Fauci, we can't just say things off the cuff. But with more and more data coming out, with more and more biology coming out, we're able to sort of say things. And so you may get that response from your doctor who's not reading things, who's not looking into different literatures, saying, this is what I've always done, and I'm not going to put myself on the line. But the data's out there, the experience is out there. I mean, years ago, saw palmetto, which was said to help with prostate cancer, was sort of said, it doesn't help. Now, saw palmetto has been proven to be almost effective as some of the other anti-cancer medications. And so, yes, things are changing. The data is out there. And I think we are at the forefront that only in 2018 was CBD becoming sort of a widely accepted. And so since then, we're beginning to see different experiences. And so that's, I think, is our biggest point with that.
And I know with Dr. Carol Jagdeo, she has over 300 patients, and she's been following them. So she's even doing her own pilot study. She's following them on diabetes and different things that as they come back 3 weeks later. So we haven't, and she hasn't even reported, we haven't seen any side effects. We have quite a few of our patients on it. We're seeing nothing but positive. And we're asking them to please let us know how they're doing. I have a friend of mine, I won't name her name, she's a physician. She said the only side effects of CBD is good health.
Now, as a medical qualifier, I actually do qualifying for the state of Maryland for medical marijuana. And a number of my clients, when they come back, they said, I don't want the THC. I really am looking for more CBD products because that's what gives me the effect. And so we really are seeing more people who are using the CBD as their major point, as opposed to looking for the THC. And they're seeing significant improvement on a number of the conditions.
Okay, I got a double question here. It says, have you guys experienced anything with the nano tincture, the new release, the nano tincture, and also how do you approach doctors with the opportunity with CBD?
Well, let me sort of hit on that. One, the nano tincture, for some reason, I use that more. I don't know whether it's being a kid, I like spraying stuff from my mouth and taking it, but it's kind of easy to take for me. So I do find better, quote, compliance with it, okay? In terms of the response, I sort of take it as sort of a general good health, and that's why I'm sort of using it. How do you approach doctors? And Marilyn and I's group has a lot of physicians in it. And we don't always sell the financial part in the beginning, because lots of us doctors, we went into medicine because we want people to be, just Marilyn said, good health. So sometimes by approaching a point of the health, and of course our PDQ, because it works pretty darn quick, it's pretty impressive for a lot of doctors.
Sample.
You know, give them a sample, let them try it. And when we see our patients kind of come back saying, I don't need a stronger medication, I'm actually doing better, I feel better, because we want our patients to feel better. We want them to live as long as they can, as healthy as they can, as Dr. LaSalle Lafall always taught us.
Yeah. So when I got in, you know, I'm an example. I got in because I wanted to help patients. I mean, I was interested in the financial part of it, but I wanted to help patients, and I realized that the thing works. I mean, the financial part is good, you know. So I agree with Dr. Corder. I would emphasize the fact that the products work, and they can help a lot of patients. So that's what I would do.
Wow. Dr. Gooray, want to add on to that?
No, I agree. Our primary function as physicians, let's be honest, we treat pain irrespective of our specialty, as Dr. Allen said, and especially our specialty by default. My average age of my patient is 70 years old. What are they going to have? Pain. They're not going to be able to function. And so we inherit this whole problem of a patient with pain, and then we have to address their other issues. So as Dr. Allen said, I approach it the same way. I said, look, there's a compound here which, in my mind, in that individual person, it's safe, and it's going to help them with their most important problem, pain. And I think that's my contribution to their health. Now the fact is, now if I can relieve their pain, now I can really find out how their heart is functioning, because now they're going to be able to do things and walk. And now I can even better protect their heart, because now I get them to do things, they physically do things, and I know their limitations. They didn't have to downgrade their activity, and I didn't have a clue as to the importance of their heart disease. So indirectly, you get information that helps them in the primary reason why they saw me as a cardiologist, but that's not the main reason why they see a physician. It's always pain.
Yeah, I can give you another testimonial. I had a patient who came to me for clearance for surgery, and she couldn't walk on the treadmill, and I sprayed her knee. And then afterwards say, yeah, I can do the stress test now.
Yeah.
So you know, the thing works immediately, and it gives us more opportunity to do more tests and get more information from our patients, and it works.
Absolutely. So speaking of that, that's almost like a default setting for losing weight. A lot of people don't get on the cardiovascular machines because they're in pain. So this is an actual benefit, like sidebar. Also,
Right.
in terms of the pharmaceutical sales reps, and we have a lot of distributors in terms of trying to approach doctors with oxygen CBD. What can they do to kind of rise to the top of the list? Because there's a lot of competition with pharmaceutical sales reps, and our group is not as efficient or used to that protocol.
I think that lots of times, most people's experience with doctors tend to be on a more personal level. And the fact that you know them, and then sort of giving them literature and maybe even a sample, as opposed to trying to be that competitive edge of getting that appointment going in. If it's somebody that you know, that's a key. And then if you can get one doctor that may be interested, and then other doctors could be interested in it. And so I think our key is have that conversation, be willing to leave a sample, whether it's a spray or a cream, particularly the spray, and then just talking. Most of the time when I talk about CBD, it's not the question or the answer of what is it, it's what do you have? Because it is a very common conversation. Whether you're looking at AARP, whether you're looking at Time Magazine, whether you're looking at your throwaway magazine, it's always out there. And so I think if you capitalize on that point, that this is the common conversation, and you sort of just breach the conversation, do something, that helps a lot.
The other thing about this, doctors, is, a lot of us doctors don't know that CBD is different from THC, different from marijuana. I mean, a year ago, I didn't know that. And so when I call a few of my docs and tell them about CBD, one guy said, I just got the license the other day. So I said, no, this is different. So a lot of doctors don't know that it's legal and it's different. It's not THC. So, just educating us on that is very important.
Of course, people are asking about COVID-19. In light of what's going on with COVID-19, is there any evidence that CBD will help your immune system to avoid COVID-19?
I have been on 4 shows yesterday talking about COVID-19, from New York to Florida, etc., as well as my show. Okay, so I've been in contact with the functional doctors for the past 4 weeks. I'm chief of staff at a hospital that I love and wow, just love so dearly, Greater Southeast. And of course, so my 2 colleagues have been there, as well as Dr. Norman is still on staff there. So what we're doing is trying to educate the public in general anyway. CBD is an immune booster. We know that. We're talking about what COVID-19 does. It attacks your respiratory tract. There are people who survive, with 80% of people who are COVID positive survive. And they were telling us initially that it was because that people were young and they were healthy. Well, actually, your immune system is more boosted up when you're young and healthy, versus as we get older, our fight back, our immune system is less. So CBD is the answer to the immune system. CBD tea, as we talked earlier, the hot tea, CBD tincture, the nano, and to take it. You might be taking it twice instead of the 1,000 milligram. Take twice. As a fighter on the forefront in terms of with seeing patients, etc., we need to take our CBD in a double dose. The gummies, the mints, you know how that mints helps open up your lungs, open up your airway, etc. Pop 2 mints a day. So because it's in the respiratory tract, it starts with what? The throat being sore. So if there's ever a time for you all to say, look, this is COVID time, sell a 10 of mints. So it's not going to hurt, but it will begin to fight that virus. There is no cure-all. It's a virus, but you have to have your fight back. And there's many things that you could put in your fight back tool chest, such as those natural things, your CBD tea, your CBD mints, and your tincture or nano. And I recommended that wholeheartedly. And all I can say is let's continue to fight this virus in a way that we know how with CBD.
We have Senior Vice President Linda Scott Reed on the line. Linda, ask your question.
Hi, good afternoon, everyone. Dr. Marilyn Corder, my other 2 doctor colleagues, you guys are killing it. You're doing an amazing job, just educating everyone on the power of, oxygen CBD. And I just wanted you guys to elaborate to everyone, how all CBD isn't created the same, and why oxygen should be the brand of choice, and the COA and our FDA approved facilities. Can you guys elaborate on that? That will be awesome. And then also, can you talk a little bit about CBD and cancer? Dr. Corder, I know you have a great story about your mom. So if you can share that, that would be awesome. Thank you guys so much.
Thank you. And I did not want to start by taking a whole hour with that, but Linda's right. Thank you, SVP Linda. Scott Reed, I'm gonna make it fast because Fred is nodding me saying, hurry up, hurry up. So with the choice of this company is for so many reasons. It has a certificate of analysis per product. The batch, the CBD, every one product, you can trace it back. It's grown in the United States, not China. It has a FDA approved certificate for where the labs are, where the products are produced in the labs. It is compliant with the 2018 Farm Bill. So this company crosses every T and dots every I. And that's why I started endorsing it. Of course, all CBD is not equal. There are documentaries with Sanjay Gupta and Dr. Oz And we know, and when you go into the stores, as we've been doing for a while, we call it, we're the shopper police. We'll go in and see what the CBD that Wegmans has, or what the CBD is CVS, and even in beauty places. And it's junk. You know, it's $29, because some of our reps will say, well, you know, I'm getting people saying, well, yours is so expensive. Well, you get what you pay for. What they're charging $25, $29, $39 would be $1 compared to what we have. So you want to make sure that you're getting the right thing and that it's doing what it's supposed to do. This is no joke. COVID-19 is no joke. So don't take the fake stuff. It's like taking a thing of orange juice and you have a drop of orange juice and you have a big gallon of water versus real orange juice. Go for what we know, which is the best product, CBD from Oxygen. Yes, it does fight cancer. Oh my goodness. My mom was diagnosed with lung cancer, inoperable lung cancer, some 5 years before, well, 5 years ago or so, but 7 years ago, sorry. And she was told that she would have 6 months to live. You know, we do that as doctors. We need to stop. You know, telling folks how long they have to live. I mean, we learned in the booklets, like when you have this condition, this is your prognosis, this is how long. So the doctors told us, the oncologist told us that your mom has 6 months to live, even with chemo and radiation. So my mom said, okay, let's go for it. And, you know, being my mom, you know, she was ready and said, I'll do as much as we're supposed to do. So we did the chemo, we did the radiation. However, a friend of ours, who's a functional doctor, came over to the house with a dropper. It didn't have a label, but a dropper. And he said, a bottle with a dropper. And he said, give this to your mom under her tongue every night. Well, we did that. And it was CBD. And instead of burying my mom 6 months after her diagnosis, not only did she enjoy a quality of life for an additional 5 years, her tumor that was huge in her chest turned into what we call a ghost tumor. The CBD that my friend gave us, that we gave every night, allowed my mother to, her cancer disappeared. And she maintained full cognition, no Alzheimer's, no dementia. We didn't have to give her the methadone, the things that the medicine that hospice was giving us that was still in the bags. And she knew everything she knew, from her bank card, her account number. She was running her business, telling us what to feed her, etc. And she transitioned comfortably at the age of 90 years old. So I'm going to tell you, instead of 85, the oncologist said she'd be gone by 86. She got stronger and stronger and stronger as we did the CBD. No pain, appetite was great. Cognitive was there. So yes, thank you, Linda. And that was, CBD wasn't even legal then, but I can tell you story after story of folks that we know was using CBD and getting better. And that's my personal story. And I'm thankful. And I think God showed that to me in order for me to finally wake up and say, no, I didn't learn it at medical school, but I'm seeing it right before my eyes, the power of CBD.
Okay, well, we don't have enough time to answer all these questions. There's so many questions here, unfortunately, and there's so much great information on this call. What I like to do to kind of land the plane a little bit here is just ask everybody for their final contributions or opinions about what we just talked about as a whole.
We'll start with Dr. Gooray.
David?
You know, as I said earlier, as physicians, I think our primary objective is to treat pain, irrespective of our specialty, because that's the most common human affliction when patients see a doctor. And when you've got a compound that addresses pain, and in my mind, so far, you don't pay a price for that, not financial price, but medical price for it. I think it's something that we need to look at very carefully. We're going to find, I'm discovering along the way the cross-section of benefit of this compound. And I think we're going to, maybe it's not going to replace traditional medicines, like we shouldn't stop our blood pressure medicines and all the other things we have. But I think it's going to be complementary to a lot of things we do. And not only that, when we allow our patients to function better, then we've added something to their life. We've added quality to their life, and which is, I think, one of the biggest benefit of this compound. And if I use my mother as an example, and as time go on, we're going to find out a lot of things. Not only its effectiveness in certain conditions, the broad spectrum of its effectiveness and its relative safety. And that's something I'm looking forward to. I'm looking forward to other things to understand about the drug, other things about its biology, other things we're going to learn over time.
Thank you. Dr. Allen?
Yeah, well, you know, a lot of you guys who may know me, some who don't, would know that yeah, I'm a quiet guy. I don't usually join a lot of bandwagons. I mean, you know, I'm the last guy to jump on the bus. You know, I usually study things, I investigate things before I get involved. And I'm involved with this company and with these products because I know it works. And I'm helping a lot of patients. I'm a cardiologist, but I'm helping a lot of patients because they have pain, you know. And the thing works. I mean, there's no question about it. You know, as soon as I spray these folks in my office, they're ready to buy the product. You know, one patient sent me a video of her mom coming down the stairs, and I shared it with the Corders. Right. She's coming down the stairs without pain, and I've had a lot of testimonials like that. You know, the products work, the product sell itself. You don't have to advertise it too much. You just, you know, just use it one time and it'll sell itself.
Well, I know that we wanted to put this video together, or this webinar, to be able to say that even though as physicians we have a lot of good recommendations, sometimes we don't always have all the answers. And that with the CBD coming out and more people using it, we're seeing advantages to it. This is not a cure for all, but it does help with the balance. And just as we talked about in the presentation, we see those different areas that we get the homeostasis. Unfortunately, all of our data is not in yet. We'll get some more data as time goes on. But I think there's an opportunity here for us to work with our physicians to teach us things, our patients to be able to share, and even ourselves to help repair our lives and be more healthy and enjoy life.
There's certain things that we have to understand, even as physicians, as we are taking care of our patients, is that, as David said, pain and quality of life. And we took an oath to do no harm. And in doing that, we want to make sure that not only we do no harm, but we educate. As I say all the time, knowledge is power. And we want to have the village understand we are empowering them to be healthier, to have a quality of life, and to understand what their body is doing. And this has allowed me to reach across the aisles of even the seniors, the adults, etc., beyond pediatrics, to help. I can't give anybody my medical degree, as I said, but I can give them an opportunity to assist and help and improve the health of the village. So I'm excited about it. I'm SVP Marilyn-Corder. I'm excited because it allows me to do medicine even in a manner that I would not have thought I would be able to do. You know, people will say, well, you know, how does this work and where it works? And I'm spending more time, I'm educating, and I'm building a team of reps who share and care about their relatives, about the community. So I'm going to say thank you, Tupac, for putting this together. We're grateful. And this won't be the last. I want to thank Dr. Fred Corder, National Director, who is one of my reps that took me ET. And of course, my colleagues, my dear friends, my previous students, Dr. Norman Allen and Dr. David Gooray. And a lot of you are out there, Dr. Sandra Charles, Dr. Carol Jagdale, a lot of physicians, and caretakers and providers rather, who know. So we just have to continue to educate our circle of friends, our community. And again, I want to say thank you for listening, and protect yourselves from COVID. We'll be continuously, you know, making sure our patients understand and our village understands how they know that CBD oxygen products will help them in this fight. Thank you.
Awesome. And I'd like to also add in closing this webinar is the fact that, you know, I'm not a doctor. I'm not a doctor. I just saw an opportunity 12 years ago to get involved with this incredible opportunity. And this is the first time in 12 years that we've actually had a product that I would suggest to anyone that has any of these underlying conditions for free. I mean, if I knew that this helped you, I would do it for free. I would say you need to check out CBD. And it just so happens that we have an incredible compensation plan attached to helping people. And that's what this is all about. That's why we're really excited, is the fact that not only are we helping people, someone was going to make the money anyway, right? But now we're properly positioned to benefit financially from that recommendation through a home-based system. And right now, more than ever, is probably the best time to have a income stream aligned from your house, from your household, without having to go out there and potentially get infected with COVID-19 and all of these things, that craziness that's happening out there. So what I would do, if you're interested from a prospective, getting involved in the business on the accounts receivable side, with CBD, we strongly encourage, if you see here, we have our newest promoted Senior Vice President, Cecil Calise. He's doing a presentation at 8 p.m. Eastern Standard Time. If you're a guest of the doctors, feel free to go to buildingforwealth.com, and you'll actually be able to register and name who invited you out to this presentation that's happening this evening. And in about 30 minutes, you'll see the opportunity side. And I would not be here 12 years in the business today had the compensation side of this opportunity not been very strong. I've made millions of dollars with this opportunity. I had no experience in networking or any of the knowledge base of CBD prior to, but I can tell you that, being able to help somebody change their life, some people that will not stand up now are standing up on their painful knees and stuff like that. It's just incredible to see people turn around, and it has a positive psychological effect. People get depressed when they can't stand up or can't exercise. So the benefit in terms of helping people quality of life with this now CBD opportunity is just amazing. It helps, I would say it's a full life benefit all around, spiritually and physically. So I'm excited to continue down this path. Our products are amazing. We continue to have cutting edge, curb jumping, additions to our mature product line with the nano tincture and CBD infused coffee and teas. So many different things. We also have Captivita, which we didn't even talk about on this call, but there's so many benefits that you can learn tonight. Our whole product line, in addition to how we make money with the opportunity as well. So feel free to take a snapshot, buildingforwealth.com. You can register now and log on at 8 o'clock. And in closing, we'll see you on the beaches of the world and definitely at the bank. This webinar is officially over. Thanks for logging on.
Thank you.
All right. Thanks. Thank you.
Thank you.
Thank you.
Thank you.